Hello, this is Dr. Gay from First Lake MRI, and this is a 14-year-old boy who plays soccer. He's had pain in his heel for a couple years and has seen an orthopedic surgeon about that, and the surgeon wanted to make completely sure that they were treating the right thing. He wanted to exclude other things. So in the back of the foot here, this is the calcaneus, and common things back here in young athletes, we get stress fractures. Usually they're up at the top here where we see marrow edema, and I don't see that. Sometimes you can have inflammation of the Achilles tendon. His Achilles tendon back here looks great. Sometimes they can have edema or fluid back here that can cause retrocalcaneal bursitis or peritendinitis. And his Kager's fat pad, this little triangular area, looks pristine, so there's no peritendinitis. There's no fluid here, no retrocalcaneal bursitis, so that looks great. And sometimes you can have inflammation of the plantar fascia down here, but that looks great. So we're left with one last thing, which is calcaneal apophysitis, or Sever's disease, S-E-V-E-R-S, and that is inflammation of this area here called the calcaneal apophysis. Children sometimes can get irritation or inflammation of this as the Achilles tendon comes down, attaches to this apophysis, and with a constant tugging motion in these athletes, the apophysis can become inflamed. You can get marrow edema within the apophysis and on the other side of the growth plate here in the calcaneus, and that is the case. So this apophysis also has a little bit of fragmentation. You see a little dark line here. So instead of one nice clean uniform piece, there's two pieces here at least. So it's fragmented. That goes along with it as well. So this is a case of Sever's disease or calcaneal apophysitis related to constant distractive forces from the Achilles tendon attachment on this apophysis. And the findings are fairly subtle, but there's abnormal brightness at the interface here on both sides of the growth plate or the physis. And then the apophysis over here in the very back has a little bit of hazy marrow edema, and it also is fragmented that goes along with this. So luckily this is self-limiting. Patients will be treated with rest, icing, non-steroidal anti-inflammatory drugs, and usually they do very, very well. And as the apophysis eventually fuses with skeletal maturation, this will go away and have no long-term effects. But this is a case of acute Sever's disease.